And it's kind of a neat segue into this next question. My elementary age child with selective mutism talks to some friends and plays non-verbally with many, but struggles to separate from parents and enter school. Interestingly enough, this same child was able to separate quite easily in kindergarten. So it sounds like this is somewhat new this school year. Is this related to SM or adjustment, and how can I help? And before you give your input, I would like to say selective mutism doesn't cause anything, it's a result of. So I need our listeners to understand SM isn't causing it, it's a result of. If your child has social communication challenges, those social communication challenges, of course, are, a result of a reason. And we have to understand those reasons. And so when I hear this question, the first thing I think of social comfort connection precedes confident communication and also just even confidence. Does this child have the supports to help them separate and feel secure? Thoughts on your end?
I was gonna say actually a very similar thing, so like mother like daughter, but I was gonna share that, yeah, I think we know that, our comfort and our communication changes setting to setting and person to person. So I would be curious about, was there something different going on in this particular moment for this child in this particular classroom with these particular people? Was there a moment that happened maybe during the school year, right? So is it that you're noticing this separation more drastically? And maybe we want to explore that more with the teacher, because I have seen this with some of my clients where we do have a very sensitive population. And so I actually was just working with a family where the child recently, it's kind of become a little bit more exacerbated with their separation. And then we had found out that, there were a few kids in the class that were making some comments, and the child is very sensitive, but also, again, doesn't always feel as comfortable to advocate for that. And so we had to kind of navigate that too. So my thought is the separation is coming for a reason, right? In the fact that you're that safe person and you're that comfort. And so how can we create more of that comfort into that environment? And it might take step by step, it might take intervention, it might take a conversation with the teacher. But I definitely think that it is common. There's nothing wrong in that scenario. It's more like, let's take a step back. And we always say, like, look, listen, and learn. Like, what is it about that situation that is maybe going on for my child? And then there also are many kids, when you said, is it related? As Dr. E said, I mean, yes, SM is a result of, but there are also many kids that have other anxieties, right? Separation anxiety, social anxiety, generalized anxiety. Like, it is a social communication anxiety. And so, with that, again, we do have a tendency to have a population of some individuals that have a mixture of different anxieties. And so, that could be a piece that's playing a role. But the reason I'm leaning more towards what is maybe going on more in this environment is, as Dr. E said, it sounds like for this child, we didn't notice this maybe a few years back in school. So something maybe about this specific space is causing more of that separation challenge.
And because we have so many sensitive beings, right? Loud, large, lots of people. Was kindergarten class? It sounds like maybe we're like a first or second grader. Was the kindergarten class and maybe the first grade class smaller, less stimuli? I have a patient I was working with recently that really struggles in class this year. Part of the reason was there were multiple boys that were very not only outgoing, but inattentive. And so there was very like a loud classroom with a lot going on and overstimulating for this sensitive child. So that kind of fear was elicited and that avoidance was elicited. And so what are you going to do? You're going to hang on. You're going to hang on to what's comfortable for you. So assuming these things have been ruled out, like you said, I love it that you brought up what's happening in the classroom. I'd like to kind of talk about what accommodations are in place to help this child and interventions to help this child with the separation. So, what is the connection, the comfort level with the teacher? Has this child, built that comfort connection with the teacher in a one on one small group way where that child feels there's a safe person, someone they can really connect with? A lot of teachers have 30 kids in their class, 20 kids in their class. It's hard to build that. Social comfort precedes, communication. It fuels that connection, fuels confidence. It fuels it all. So I would want to know that. Are there buddies that this child is connected to? You know, it's one of the hallmarks to social comfort precedes communication. Progress doesn't happen in a group, is create a buddy process. Does this child have two or three buddies that this, parent is pairing, grouping, having outside get-togethers? The parent did mention that there's some friends that the child talks to. Is there still a safety there? Is there still a comfort there? Is the teacher consistently pairing and grouping? I've had kids with separation anxiety. One of the things that we've done is we go to school, either pick that other child up if they're a nearby neighbor, they sit with them on the bus if they're taking the bus, or they meet them in the school playground or drop off and they walk in together. So
Mhm.
I've had many kids that meet their friends right at the kind of the drop off and walk in together. I've had to do it where the parent walks in, drops the child off, then the net, creates this game or this chart with the child where we drop off. And then the next day it's 5 feet further from the classroom, 10 feet further, 20 feet. And we do this where the child checks off, rates their feeling, checks off. It's all about this child feeling in control.
Mhm.
So there's so many things we can do aside from worrying about talking right now. But if this child isn't feeling safe and secure and feels almost abandoned, we need to talk with this child about it and feel and like you said, what is missing? Because there are ways to transition from separation anxiety, with separation anxiety, but is this separation anxiety a huge aspect outside of school? We have kids that can't even separate in the home. They can't go to the bathroom without their parents. They can't go to a friend's house. They can't hang with grandma or grandpa. There's a lot of separation. So I would want to explore the separation more. What's going on in the home environment versus is it just with school?
Yeah. I would be curious about how are we modeling our behavior as well with that child? And many times our kids feel, again, we're talking about how they're very sensitive. Our kids feel our emotions and our feelings as well. And so
Great point. I
sometimes,
love this.
yeah, well, sometimes I have to talk with a lot of my parents that have some kids with separation because that doesn't feel good for me as a parent, right? Like, I don't want my child to feel this way, and so I'm on edge as I'm dropping them off, and then that's making my child more on edge, and it's kind of this cycle, right? And so we have to also work with you as parents on how can we make you feel comfortable, and how can we make you feel reassured to know everything's gonna be okay, and let's put interventions in place. But
Yeah.
I do think that we have to keep that in mind because our modeling is so much stronger than we think.
No,
And I
I
just
think it's
wanted
a
to
great
emphasize that.
that is a great point, so thank you. I mean, many of our look, when you're anxious, you get like a flat affect. You can almost look angry, and that's not your fault. I mean, it happens to all of us. I mean, we see this with families that come to us sometimes. They're so nervous, they're so anxious. Like a family flew across the country, has been in treatment for 4 years. This is our last hope. The parent's nervous and anxious. Like, and so sometimes they have that like flat affect at first, and we realize that's their anxiety. But if your child is picking up on that and seeing you anxious or, looking upset with them or frustrated, then yes, that's going to project onto them and make them actually hold on deeper and more because they're fearful. Like, I'm making my mommy anxious, or what's going on, or she seems angry at me. So, of course, we're not saying this is happening necessarily in this particular case. But the point of these questions is because we're not working specifically necessarily with you, is to give you different angles to think about so that whomever you're working with can help explore this. What are the accommodations, interventions in the school? What is set up to help the child with separation, the buddy process, the teacher meeting you outside, creating charts to wean you out? And what is the separation and challenges in the home environment to see how pervasive this separation is? Are there other anxieties, generalized anxiety? Are there other whys? Is sensory an issue? Like, what is going on? Is that, what else is happening? You mentioned the child is speaking to other friends, but is it socially appropriate language? Is there social reciprocity? Is there, rigidity? Like, are there other whys happening that we need to address? So I think it's very important that we see this again from a whole person standpoint, since I preach that. That's what SM treatment is, treating the whole person and not a symptom. I swear by that to my last day on this earth, is that if we treat to speak without understanding, we're going to miss the boat on most individuals. So this understanding of this child is important. In fact, even if you told me your child wasn't verbal, all of these things would still need to be in place. So, yes, she's verbal with some. I don't even know what her communication is or comfort with her teacher. So, the point is, thank you for that baseline. But the speaking I can set aside right now because all of these other things need to be in place.
Exactly.